Hello guys, today we'll be talking about Lyme disease and we'll be talking about Lyme disease under the following headings: Introduction, Causative agents, Pathogenesis, Epidemiology, Risk factors, Diagnosis, Prevention and control, as well as treatment. What is Lyme disease? Lyme disease is a vector-borne zoonotic infection that is caused by spirochetes of the Borrelia burgdorferi sensu-lato complex. Lyme disease is the commonest tick-borne disease that is common in temperate regions of the northern hemisphere, particularly in North America, Europe, as well as in parts of Asia. Humans get infected by the bite of an infected Isodis tick, popularly referred to as a deer tick or a black leg tick. Clinically, Lyme disease has a wide spectrum of manifestations involving the skin, the nervous system, nerves, joints, as well as the heart and other organs. If not promptly diagnosed and treated, Lyme disease can transcend or progress from an early localized infection into a chronic and even potentially disabling late-stage disease. The variability of symptoms and the overlapping of other conditions make Lyme disease a diagnostic challenge, especially in endemic regions. Let's talk about the causative agents of Lyme disease. Lyme disease is caused by spirochetes. Spirochetes is caused by spirochetes of the Borrelia burgdorferi burgdorferi. Okay, Borrelia burgdorferi sensu lato complex. Sensu lato complex. Lyme disease is caused by spirochetes of the Borrelia burgdorferi sensu lato complex. The organisms in this complex are gram-negative, they are motile, and they are also helical or spiral in shape. They are also microaerophilic, meaning they thrive in environments with low oxygen. Also, the organisms have a, a flagella known as a periplasmic flagella, which they utilize for movement. Let's see the grammatic expression of how it looks like. You have this, it is spiral in shape. The spirochetes are spiral in shape. And then you have a periplasmic flagella is bound to it. Periplasmic flagella. The periplasmic flagella enables motility, and not any kind of motility, but a corkscrew-like motility. This motility is more or less like a drilling action, and it aids the tissue penetrative ability of the spirochetes, as well as the organ evasion ability. Very important. Major species, pathogenic species of the Borrelia burgdorferi sensu-lato complex that is involved in causing Lyme disease include: one, we have the Borrelia burgdorferi. We have the Borrelia burgdorferi, Borrelia burgdorferi sensu stricto, sensu stricto. They're actually together. Borrelia burgdorferi sensu stricto. This is the major culprit when it comes to causing Lyme disease. It is particularly predominant in North Africa, in North America rather. We also have the Borrelia afzeli. The Borrelia afzeli is associated with cutaneous involvement, and it is particularly predominant in Europe. There's also the Borrelia garini. The Borrelia garrulin is more commonly and frequently associated with nervous or neurological involvement of Lyme disease. It is particularly predominant in Europe and certain parts of Asia. These are the major pathogenic species in the Borrelia burgdorferi sensu lato complex that is responsible for causing Lyme disease. These pathogenic organisms have an outer surface protein, especially outer surface protein A, OSPB, and OSPC. Outer surface protein A, outer surface protein B, and outer surface protein C. The presence of these outer surface proteins aids in tick colonization. It enables the pathogens to colonize the tick, particularly the midgut of the tick. It also aids in transmission of the pathogen from the tick's salivary gland to the host, in this case, humans. These outer surface proteins also enable immune evasion, helping the pathogen to evade the immunological setup of the host. These pathogens also possess surface antigens. They also have the ability to cause a variation in their surface antigens, and this enable them to persist in the host cells. So this is basically about the causative agent. Let's talk about pathogenesis of Lyme disease. The pathogenesis of Lyme disease involves a complex interaction between the pathogen, which causes Lyme disease, the host immune system, as well as the vector. Infection usually begins when an infected isodis tick or a dead tick, popularly known as a dead tick, takes a blood meal from human skin. And it usually takes about 24 to 48 hours of attachment for transmission to occur. This is from the Center of Disease Control. During blood feeding or during blood meal collection by the tick, the Borrelia species usually migrates from the midgut of the tick to the salivary gland, and then from the salivary gland, the pathogens are deposited on the human skin. Once in the human skin, the pathogens undergo local multiplication, and this local multiplication leads to the formation of what is known as an erythema migrans. Erythema migrans. Erythema migrans is basically a reddish lesion, and it is the hallmark of early localized Lyme disease, a very important diagnostic feature. Once the pathogen is in the skin and the erythema migrans has been formed, the pathogens are then spread hematogenously. That's through the bloodstream by entering into little capillaries into the bloodstream. They also spread via lymphatics. The spread of the Borrelia species in the lymphatics as well as the bloodstream leads to a triggering of the immune system, causing the innate immune system to trigger the release of macrophages, of neutrophils, as well as cause cytokine production. The adaptive immune system also responds by causing the production of antibodies to detect or to form or to cause an opposition to the Borrelia antigens. But these mechanisms do not completely eradicate the presence of the pathogen. This is majorly due to suppression of complement activation and alteration of surface antigens by the Borrelia species. Persistent inflammation occurs in tissues due to the presence of the Borrelia species in these tissues, and this can cause tissue damage in joints, in nerves, as well as in cardiac tissues. Chronic infection can also occur, leading to Lyme arthritis, neuroborreliosis, and a condition referred to as acrodermatitis. Acrodermatitis chronica atrophicaans. Chronic infection of Lyme disease can lead to this condition known as acrodermatitis chronica atrophicaans. This is basically a late stage skin disease that usually develops as a result of untreated Lyme disease. It is usually characterized by progressive thinning and discoloration of the skin, usually in the extremities, and it is accompanied by pain, swelling, and nervous damage. This is basically the pathogenesis of Lyme disease.